Have you ever woken up feeling incredibly tired, noticed your ankles swelling, or dealt with a nagging dry cough that just will not go away? If you are taking Amlodipine, Losartan, or Lisinopril for your blood pressure, I need you to listen very closely right now. Today, we are going to talk about 6 silent side effects of these incredibly common medications that your doctor might have brushed off as just a normal part of getting older. We are also going to cover some critical, life-threatening mistakes you might be making with your daily doses, exactly how and when you should be taking them, and safer alternatives if these pills are doing you more harm than good. I promise to keep everything simple and easy to understand. You are going to want to hear this, because knowing these hidden signs could literally save your life or the life of someone you love. So many of us trust our doctors blindly, and that is a beautiful thing. But we often forget that medications are powerful tools that require careful handling. One of the biggest mistakes millions of people make every single day is combining these blood pressure pills with the wrong everyday foods, over-the-counter painkillers, or taking them at the wrong time of day. This can trigger serious health problems, from destroying your kidneys to causing sudden fainting spells that lead to broken bones. Sometimes we experience a side effect and just assume our bodies are simply breaking down from age. We feel a little weaker, a little more tired, or a little more foggy, and we tell ourselves it is just the passage of time. But what if it is the very pill meant to protect your heart that is secretly stealing your vitality? Let me tell you a true story that really drives this home. Last year, a 62-year-old patient named Robert was rushed into a clinic down in Dallas, Texas. Robert was a grandfather, a retired mechanic, and generally a pretty happy guy, but over the course of a few months, he started feeling incredibly sluggish. His legs felt like lead, he was dizzy every time he stood up from his favorite armchair, and his chest felt fluttery. His regular doctor told him he was just stressed and getting older, maybe needing more rest. But Robert was not just getting older. He was actually dying right in front of his family, and nobody realized it until his wife found him collapsed on the kitchen floor, barely breathing and completely unresponsive. When the paramedics brought Robert in, his heart rate was dangerously irregular, and his blood pressure had completely bottomed out. It turned out Robert was taking Lisinopril for his blood pressure, but he was also trying to be healthy by using a salt substitute on all his home-cooked meals. What his doctor never told him was that salt substitutes are packed with high amounts of potassium, and Lisinopril also causes your body to hold on to potassium. Robert had basically poisoned his own heart without ever knowing it. His potassium levels were so astronomically high that his heart was literally moments away from stopping permanently. It took emergency medical intervention to flush his system and stabilize his fragile heart. Thank goodness Robert survived. But his terrifying ordeal in Dallas is exactly why I am sharing this urgent information with you today. Once his medication was adjusted and the salt substitute was thrown in the trash, all of those normal signs of aging completely vanished. His energy returned, the dizziness stopped, and he got his wonderful life back. This happens far more often than you might think, which brings us to the 6 silent side effects of Amlodipine, Losartan, and Lisinopril that you simply must not ignore. If you are experiencing any of these, please do not just accept them as your new normal. Let us walk through them together so you can understand exactly what your body is trying to tell you. The first silent side effect is a dry, persistent, ticklish cough. This is extremely common if you are taking Lisinopril. Millions of people develop this annoying hack and just assume they have a lingering cold, seasonal allergies, or perhaps their lungs are just getting older and weaker. Your doctor might even prescribe allergy pills or cough syrups that do absolutely nothing to stop it. The truth is, this medication causes a specific chemical to build up in your lungs, constantly irritating the airways. It is not an infection, and it is not old age. It is the pill. And if it is keeping you up at night or making it hard to have a conversation, you do not have to just live with it. The second side effect is mysterious swelling in your ankles, feet, or lower legs, which is a classic hallmark of amlodipine. Many folks notice their shoes fitting tighter at the end of the day, or see deep sock marks pressed into their calves. When they mention it to friends or doctors, they are often told it is just poor circulation from getting older or from standing on their feet too long. But amlodipine works by relaxing your blood vessels, and sometimes it relaxes them so much that fluid leaks out and pools in your lower legs due to gravity. This fluid buildup can make your legs feel incredibly heavy, painful, and exhausted, stealing your mobility and making you feel much older than you actually are. The third silent issue is sudden dizziness, or a dark wave of brain fog, especially when you stand up quickly from sitting or lying down. You might feel a little woozy, need to grab a wall to steady yourself, or feel like your mind is just moving through thick molasses. It is so easy to brush this off as a natural part of aging, but it is often because Losartan or amlodipine is pushing your blood pressure too low, too fast. This sudden drop deprives your brain of oxygen for just a few seconds, but those few seconds are more than enough to cause a devastating fall. Broken hips and serious concussions in older adults are frequently linked to this exact, highly preventable side effect. The fourth hidden side effect is unexplainable fatigue and profound muscle weakness. You might feel like you just ran a long marathon when all you did was walk out to the mailbox. Your muscles might feel crampy, heavy, or just completely out of juice. Again, society tells us that getting tired is just what happens when we add more candles to our birthday cakes. But as we saw with Robert from Dallas, medications like Lisinopril and Losartan can drastically alter your internal chemistry and kidney function. When your delicate mineral balance is thrown off by these daily pills, your muscles literally cannot fire properly, leaving you feeling utterly drained of all your beautiful life energy. The fifth side effect is one that surprises almost everyone, and that involves bizarre changes in your gums and overall dental health. Specifically with amlodipine, some people notice their gums becoming swollen, tender, or even growing noticeably over their teeth. You might start bleeding more when you brush and think you just need a softer toothbrush, or that your teeth are simply failing you in your older years. Dentists see this all the time. It is a condition where the gum tissue physically reacts to the medication and overgrows. Do not let anyone tell you this is just normal aging. It is a direct chemical reaction happening right in your mouth caused by your blood pressure medication. The sixth side effect involves your gut. We are talking about chronic stomach discomfort, strange digestion issues, or annoying changes in how often you use the bathroom. Losartan, for instance, can sometimes cause severe intestinal issues that mimic irritable bowel syndrome. People end up going on strict, depressing diets, cutting out gluten or dairy, thinking their aging stomach just cannot handle regular food like it used to. Meanwhile, the real culprit is sitting right there in their daily pill box. If your digestion suddenly changed a few months after starting a new blood pressure prescription, it is not a random coincidence, and it certainly is not just Father Time catching up with you. Before we dive into the exact daily protocol for taking these medications safely, I want to take a quick pause and get to know you a little better. We have an amazing community here, and I absolutely love seeing how far our message reaches around the world. Where are you watching from right now? Are you in the UK, Canada, Australia, the USA, or somewhere else entirely? And if you do not mind sharing, how old are you? Please tell me down in the comments below. It really helps me understand who is listening so I can create better, more helpful videos just for you. So go ahead, drop your location and age in the comments right now, and let us build this wonderful community together. Now let us talk about the safest, most effective full protocol for using these medications. Timing is absolutely everything when it comes to heart health. For years, doctors told patients to take their blood pressure pills first thing in the morning with their breakfast. However, recent massive medical studies have shown that taking your blood pressure medication right before bed might actually be far better for your survival. Your blood pressure naturally dips at night, but in many people with hypertension, it stays dangerously high while they sleep, which drastically increases the risk of a morning stroke. Taking your pill in the evening provides maximum protection while you sleep. Always check with your doctor first, but moving your pill to nighttime could be a life-saving shift. When it comes to quantity and exactly how to use them, always swallow your pill with a full, large glass of plain water. Do not wash it down with morning coffee, and absolutely never use grapefruit juice if you are taking amlodipine. Grapefruit permanently blocks the enzymes that break down the drug in your stomach, meaning a normal, safe dose can suddenly turn into a massive, toxic overdose in your bloodstream. Also, be incredibly careful with everyday pain relievers like ibuprofen or naproxen. Taking these common joint painkillers alongside Lisinopril or Losartan can suddenly damage your kidneys and cause your blood pressure to spike right back up, completely undoing all the good your medication is supposed to do. We also need to talk about clear contraindications, meaning who should absolutely never be taking these specific drugs. Every human body is different, and what heals one person can seriously hurt another. If you have a history of severe kidney disease or reduced kidney function, you must be heavily monitored if prescribed Lisinopril or Losartan, as they can sometimes push weak kidneys into total failure. Pregnant women must never touch these two drugs, as they can be fatal to a developing baby. If you have severe liver issues, amlodipine can build up dangerously in your system. And as we learned from Robert, if you use salt substitutes, you must strictly avoid medications that increase your natural potassium levels. So, what do you do if you are experiencing these miserable side effects, or if you have a medical condition that makes these drugs unsafe for you? Please do not panic, because you have plenty of wonderful alternatives. If Lisinopril gives you that awful dry cough, your doctor can easily switch you to Losartan, which works very similarly but rarely causes any coughing. If amlodipine is swelling your legs, a different class of medication like a simple water pill or a gentle beta blocker might be the perfect fit for your body. Better yet, natural lifestyle changes are incredibly powerful. Walking 30 minutes a day, eating more fresh vegetables, and practicing deep breathing can sometimes lower your blood pressure so beautifully that you and your doctor can safely reduce your medication over time. I want to leave you with a comforting thought today. You know your body better than anyone else on this entire planet. If you feel tired, dizzy, swollen, or just fundamentally not like yourself, please do not let anyone make you feel like it is all in your head or just the heavy price of growing older. Aging is a beautiful, precious privilege, and it absolutely does not have to mean suffering through daily physical discomfort. You have the right to feel vibrant, energetic, and safe in your own skin. Take these hidden signs seriously, write them down on a piece of paper, and have a calm, confident conversation with your healthcare provider. There is almost always a better solution, a better dosage, or a better medication waiting for you. Thank you so much for spending your valuable time with me today. Your health is your greatest wealth, and by simply educating yourself, you are already taking massive steps toward a longer, happier, and much healthier life. If you found this information valuable and comforting, please hit that subscribe button, give this video a big thumbs up, and share it with a friend or family member who might be taking one of these very common blood pressure medications. You never know. You might just save their life with a single click. Do not forget to leave your location and age in the comments below, and let me know what health topic you want me to cover next. Stay healthy, stay hopeful, and I will see you in the next video.